Hi, everyone. I'll start by saying that what I'm about to share will not be easy to hear. We're going to talk about one of the darkest days in our recent history, October 7th, 2023. So let's all take a deep breath together. On the morning of October 7th, Hamas launched a vicious terror attack on Israel. 1,182 people were murdered, over 4,000 were injured, and 251 were taken hostage. It was one of the deadliest terror attacks the world has ever seen. And the people who were there, at the front line of the attack, were directly exposed to extreme traumatic events. The clinical definition of a traumatic event is exposure to actual or threatened death, serious injury, or sexual violence. And as mental health researchers, we asked, what will be the long-term impact of such a traumatic event like the October 7th attacks on people's lives? And research shows us that following such exposure, people tend to follow one of two main paths. The good news is that most people will show resilience, which can even lead to personal growth. But there's another path, a small but a significant group of people who will suffer from long-term post-traumatic symptoms. Nightmares, flashbacks, panic attacks, making them re-experience the trauma as if it's happening all over again. Now, decades of research have also taught us that interventions can help move people from the difficult path to the resilient one. But even with all these advances, we still don't have a single therapy that works for everybody suffering from post-traumatic symptoms. And this drives clinicians and researchers to keep trying to find new therapeutic avenues. One promising direction in recent years is the use of psychoactive substances, LSD, MDMA, ketamine, to treat mental health issues. Some of these substances have been found to have amazing potential in alleviating post-traumatic symptoms. Basically, these substances help people to process their trauma differently and more adaptively when done in controlled settings with the guidance of professionals. But what happens when you completely change the settings? When you experience the effect of these substances in a whole other context, like in a real-world crisis? Now, this question became painfully relevant on October 7th. On that day, the largest site of the terror attack was the Nova Music Festival, held near the Gaza border. Around 4,000 people had gathered there to dance, to feel free. And then the music stopped, and the nightmare began. And amid the chaos and the horror of the attack, another layer of complexity emerged. Many of the festival attendees had taken psychoactive substances. Now, these substances inherently change our perception, our sense of time, our memory. Basically, they change our state of consciousness. And this is especially important because we know from the therapeutic settings that these altered states have been connected to different trauma processing. So in response to this unprecedented event, we formed a large team of researchers from many fields that traveled all over Israel to reach as many people as possible affected by this event, even those displaced by the war. The core question of our research is, did the substances help or interfere during and after the traumatic event? And we can look at this question from different angles. We have the functional aspect. Were people able to react fast enough to escape? Did some substances help with dulling pain? Then we have the mental aspect. How did people experience the event? Did the substances help with the fear or make it worse? And later, how did their brains process it? The second angle, the mental and emotional aspect, is our main research focus. But when I talk about the effect of substances, this is a little confusing because we're not just talking about one substance. Like in many festivals, people here are taking all types of substances, each with its own unique effect. Take cannabis and alcohol. These tend to have a more calming or numbing effect. Alcohol, for example, have been connected to dissociation, a sense of disconnection from reality. Now, this might sound protective at first, but it can also make things harder to process later. So which of these effects will be more dominant? Then we have MDMA, that boosts empathy and reduces fear. In these moments of terror, did MDMA help people feel less scared, or did it blur their sense of danger? Then we have classic psychedelics, like LSD and psilocybin, the active ingredient in magic mushrooms. These are considered to be non-specific amplifiers because they intensify whatever a person is experiencing, thoughts, emotions, sensations. But what exactly got amplified here? If somebody felt fear, did that fear spiral out of control? Or if someone managed to escape, did that sense of capability get intensified? And to make things even more complicated, what happens when a person mixes 2, 3, or more substances? And the real answer is, we didn't know. There was practically no research on this. So to start getting answers, we launched online surveys less than a month following the traumatic event. We currently have more than 1,200 survivors participating in at least one of our surveys, with many tracked across multiple time points. In our initial survey, we first asked questions about what happened during the traumatic event. For example, which substances did you take? Did you feel in control? And did the substance help or interfere? But we also asked questions about what happened after the traumatic event, like how well have you been sleeping in the month since? How much do you interact with other people? And do you carry guilt with you? All experiences extremely important for post-traumatic processing. The first wave of results came from around 800 survivors that filled out this initial survey in the first 4 months following the traumatic event. 72% of them reported being under the influence of at least one substance during the event. We grouped them based on the substance they reported using. And here, I'll show you results for people who used only one substance, so we can start understanding the unique effect of each substance. Importantly, we also have a large group of people who did not use any substances, which is kind of a built-in baseline, people who went through the trauma without any added pharmacological effect. Now, when we looked at their responses, some of what we found was truly surprising. Many had said that the substances actually helped them during the event. One survivor said, "I felt like I was inside a computer game. I just needed to finish the level to get back home." Another said that she was processing the trauma while it was happening. But not all experiences were like that. One survivor told us that he saw terrorists coming at him, and he wasn't sure if it was real or a hallucination. And that moment of confusion made him even more scared. So when we asked if the substances helped or interfered, the real answer is, it depends on the substance. And specifically, during the traumatic event, people who had taken MDMA or psychedelics like LSD were more likely to report that the substance helped them. In contrast, people that took cannabis or alcohol gave more mixed responses. It didn't clearly help or hurt them. And after the event, there we actually saw opposite effects in some of the groups. The MDMA group reported better sleep quality, lower mental distress, and more social interactions in the months following the attack. The cannabis and alcohol group reported worse sleep quality, higher mental distress, and more post-traumatic symptoms. And this means that the substance may have had an effect on the way they processed the trauma, perhaps even impacting their early recovery. But these are all self-reports, people's personal experiences. And while those are extremely important, they can also be biased or incomplete. So we also wanted to evaluate the objective effects of this trauma on the body and the brain. And for this, we collected additional data. We gave survivors smartwatches that tracked how they actually slept in their daily lives and how their bodies responded to stress. We also invited survivors to an MRI brain scan, and we showed them a video of festivals. This allowed us to see how their brains responded in real time to a stressor that's related to their trauma. We're currently analyzing these signals and how they're affected by the substances and by other factors like whether or not they received therapy after the event. But by also looking at these signals holistically, the body, the brain, the emotional response, we also hope to uncover more nuanced patterns of how each person processes trauma differently. And if we can understand these patterns, we first and foremost hope we can help this affected community, thousands of people still living with the impact of that day. And from this horrible crisis, we also hope to learn something bigger, perhaps have a deeper understanding of trauma and how people can truly heal. Thank you.